Thank you for coming. We're pleased to be here today. We want to offer an alternative approach to health care reform that we want to make sure is at the table and on the table and involved in the legislative discussion this year. Last week, we introduced the proposed Minnesota Health Plan, which is a universal health care system covering 100% of Minnesotans for all their medical needs, including dental, including long-term care, including all their medical needs. We have over 60 co-authors. There's a lot of support for this around the state, in the legislature, and we want to have this part of the discussion. What's the problem? Well, we're simply wanting to have a health care system for all instead of health insurance for more. The problem right now with our health care system starts with probably the best health care available in the world, the best doctors and nurses and hospitals and medical clinics, the best medical technology and research, but the worst system for accessing it. And I see roughly two overall problems. One is about 5% of the public that doesn't have any coverage, and the other is most of the other 95% who have coverage but have ever-tightening networks, higher copays and deductibles, huge deductibles, gaps in the coverage, and that's where we are now, and the Republican proposals are going to make it worse. The House last week, when they voted for the Swiss cheese health care insurance system, had big holes in it where you're not going to cover, well, certain types of cancer perhaps, and you're not going to cover maternity care, and you're not going to cover contraception, and you're not going to cover this. It's one of the things they've done. The other approach they had that they actually succeeded in was having for-profit insurance companies into the state, people who know that the way to make profits is not by delivering care, but by denying claims. That's the way they increase profits. So that's where we are now. And most of the reforms in the last 30 years have been aimed at making it more difficult for people to access health care. Again, the tighter networks, the copays, deductibles, prior authorization, all those sorts of things. And with the Republican efforts to make it worse, you got to say, where are we headed? They've been successful at putting barriers to people getting health care. Yet, even so, we spend twice what other countries in the world spend on health care. There may be 3 or 4 exceptions to that, and they spend far less than us. We're spending twice what everybody else in the world spends on health care, despite those barriers. And I think that should beg the question, why would any society try and make it more difficult for people to access health care? Why do we want to make it so diabetics have trouble getting their insulin, or parents wrestle with whether to take their kids to the doctor? Why do we want to put those barriers in? So that's why we come forward and we say it's time for a new approach. Minnesota Health Plan, as I said, would cover everyone for all their medical needs. It would leave choice of provider not to a network or some insurance company, but a choice of provider to the patient. It would leave medical decisions to the patients and their providers, not insurance companies or others telling them what to do. And this is have premiums based on ability to pay, so it'd be affordable to everyone. The evidence from around the world, the evidence from economic analysis suggests it's actually cheaper to keep people healthy and help them get care when they need it than to play all these games to make sure nobody overuses care, which has not been a success. We think this makes sense. We want to make sure it's at the table. And with that, I'm going to turn it over to Representative David Bly, who's the House Chief Author of the bill.
Thank you, John, and thank you for coming to join us here today. We're surrounded by many supporters in the legislature and in the public as well here today. When I first started running for office in 2002, healthcare was perhaps the most common anxiety that people talked about and that they wanted solutions for. And I early on learned about this type of policy as an answer and a solution, and it was one of the things that I ran on, and I'm happy to be here today to reintroduce this bill and talk to the public and move it forward, hopefully. Until the Affordable Care Act, as John was mentioning, a lot of the policy provisions that come forward have actually been to identify a problem they called overuse of health care and trying to limit access to health care through the insurance companies, which has really been an issue that I continue to hear about even today. I think the Affordable Care Act had as a goal establishing universal health care, but it has fallen short of that. And because it's used the market model of insurance companies, it's made it even more complicated and harder to get. As John also mentioned, many other countries have chosen this kind of policy to make sure that their citizens have security and have the ability to make sure that they will move forward. This has helped entrepreneurship. It helped small farmers and business people throughout the world to make sure that they could count on that kind of care and not be restricted from it, like we see here in Minnesota and in other states. So I think this is really an important step for us to take, and we believe that there's tremendous support out in the public for this kind of thing among small business owners and among farmers who are really held out of being able to get access because of other things that happen with insurance companies, whether it's co-pays and other things like that. So we really think that this is a way to help our citizens gain greater freedom to do the kinds of things that they want to do in their life and not restrict them from being able to be sure that they have access to health care. And that's something that I strongly believe in and hope that we can persuade our other legislators. And I'm glad that there are 42 some House members who signed on to the bill. Maybe more will be beginning to do that as well. But thank you for joining us today, and we're very proud to be here to move this policy forward. Thank you.
Good morning. My name is Rose Roach. I'm the Executive Director of the Minnesota Nurses Association. The Minnesota Nurses Association is here today not only in support of Senator Marty's Minnesota Health Plan, we're here to say loudly and enthusiastically that it's about time. Finally, the proven solution to the healthcare crisis that rages on in this state and in this country. Nurses don't care about your insurance card or your credit card. Nurses care about your Get Well card. As natural advocates for their patients and frontline workers in the healthcare world, who better to articulate the reality of a system that puts corporate greed over human need? The corporatization of our healthcare system is no small matter. Nurses understand the clinical side of patient care, but they also understand the business side of healthcare and know that the current system is simply unsustainable, with as much as 30 cents of every healthcare dollar going to something other than direct care. Nurses do not believe that anyone should profit from another human being suffering. Nurses tell us that the patients that they see these days are sicker than ever before, and that's because patients get less preventative care, they wait longer for care, and not everyone has the same access to care. As the most trusted profession in the nation, for nurses, this is an inequity that is unjust, and M&A members cannot sit idly by and allow it to continue. We have a fragmented multi-payer system based on those who don't provide care, making a profit off those who need care, and that's inhumane and immoral. All we're talking about here is a system whereas everyone gets the care they need when they need it, not just when they can afford it. The reality is we don't consume health. There is no choice between illness and health. When you're diagnosed with cancer, your main focus, and your families, as it should be, is to get well, to get the treatment you need, not to go shop for the cheapest radiation or chemotherapy. That's why the Minnesota Nurses Association fully supports the kind of healthcare system proposed in the Minnesota Health Plan. It's patient-centered. Time and time again, study after study has soundly demonstrated that such a system does four things. It saves money, it guarantees coverage for everyone, it improves quality of care, and most importantly, it saves lives. Healthcare is a public good and should be treated as such, not like a commodity traded on a market of precious metals. There's plenty of money in this system. We just need to allocate it towards actual care. Nurses are healers. When you're sick or injured, nurses want to heal you, period. A major role of nursing is centered on patient advocacy. So for nurses, fighting for a humane healthcare system is the ultimate way to advocate for their patients. Thank you, Senator Marty, for bringing forward the type of a system through the introduction of the Minnesota Health Plan. Thank you.
Good morning. My name is Dr. Chris Reif. I'm a family medicine doctor currently working at a clinic in South Minneapolis. I've been a family doctor for over 35 years in the Twin Cities. I've seen a lot in healthcare come and go. I've seen some good, some not so good. And I'm here today because I'm happy to support the Minnesota Health Plan as the best solution that I've seen for what's needed in healthcare in the Twin Cities. I think it's the best solution for my patients. They get a health card. They get to come into my clinic. They hand over their card. They get sent to the nurses and the doctors where they'll get health care. What they need afterwards, their medicines, their medical supplies, going to the hospital, other providers, all of that is covered without any hassle, without any problem for them. and they will get that card at an affordable price, which is so important. I also think it's the best plan for doctors, because as doctors, I'm kind of tired of worrying about co-pays, deductibles, prior authorizations, in-network, out-of-network. None of that really has to do with health and healing. And that's the job that I've been trained to do, and that's the service I want to bring to my patients, to my community. Thirdly, I think that this is a better system. So not only is it good for doctors and for patients, but it's good for our state. It's good for what we have. To have a system that puts all of the money into providing care and not into administrative cost is really good. To have a system that's able to bargain for decent health prices, decent medication prices is really important. We all know what's happening there. To have a system that supports primary care doctors like myself to go and work into communities that need us, in the rural community and the urban communities, to support rural hospitals, to support all of the services that we need in our cities, that's a good system. So I'm here as myself as both a doctor and as a consumer of healthcare, but I'm also here as part of an organization of doctors in Minnesota, Physicians for a National Health Plan. We have over 1,000 doctors that support a system like Minnesota Health Plan that will get care to everybody and will do it in a reasonable way. When I talk to my family medicine doctors, even those that haven't signed up for our program, very much believe in a system that offers care for everybody, does it in a financially responsible way, and does it in a way that promotes healing and care and not just how do you overcome sickness. So I want to say thank you to Senator Marty and to the other legislators that are supporting this bill. I think we've got something on the table that just won't fix a few things, but will actually provide a healthcare system that's good for patients, good for doctors, and good for Minnesota citizens. Thank you.
My name is Dolores Voorhees. I am one of the leaders on the healthcare team at Take Action Minnesota. Simplifying our healthcare system has been on my radar for a really long time. In 1981, I was in Spain with my family and ended up in the hospital for 3 days. We kept repeatedly asking, when will we get our bill? And they said, well, don't worry about it. And we never did get a bill. This is in stark contrast to the medical maze we faced when we got back to the States. Since then, I've been fortunate enough to have good insurance through my employer and now Medicare, but it's not been so easy for members of my family. My son-in-law is an organic farmer and has seasonal income, while my daughter is self-employed as an acupuncturist. They work very, very hard, but would never be able to purchase private insurance, even with MNsure subsidies. Minnesota Care has been crucial for them and their 2 children. Every 6 months, there is a flurry of activity to document their income to prove they are still eligible. The anxiety of wondering if they'll continue to have insurance is an unbearable side effect of this cumbersome process. Corey, a young man that I've mentored since he was 12, is a type 1 diabetic. Over the years, he's had medical assistance and Minnesota Care, but has fallen between the cracks, too. Twice he was hospitalized because he was unable to afford his medication. Now he finally has a job with benefits. This has been a mixed blessing. Making $29,000 a year, he struggles to pay his big deductible at this time of year. He has postponed doctor visits and medication because of copays. This is untenable. These are real Minnesotans whose lives would be greatly improved and simplified if they could purchase their coverage through Minnesota Care. It would be even better if they could participate in a new Minnesota Health Plan for all. Thank you.
Greetings. My name is Heidi Morlock, and I'm a farmer in Belle Plaine Township. My husband is a church musician. We have 2 boys and have lived on my grandparents' farm since 2000. I'm a member of the Land Stewardship Project, and healthcare is a huge issue for our farmers and for all of our members. It's a barrier for young people wanting to start farming. It takes away from farms by forcing one family member to get another job for health insurance. And it's not just the farmers in rural areas who are affected by out-of-control health care costs. It's people trying to run a small business or working multiple part-time jobs, or folks wanting to retire, or a parent wanting to stay home with the kids. Lack of access to affordable health care has become a crisis, and the corporations in charge of our health care have failed us. We appreciate that the state has just provided help to people buying individual health insurance, including my fellow farmers, but we're very concerned about another piece that was tied to this needed help, allowing for-profit insurance companies to do business in Minnesota with no accountability. This is the wrong direction. Insurance companies putting their bottom lines before people's health care needs is what caused our current crisis. For several years now, because of our income level, my family has been on Minnesota Care, a public health care program with affordable premiums, no deductible, reasonable copays, and really good health care. The program has worked in Minnesota for 20 years, and it has been absolutely essential for my family. My husband and I are both self-employed, doing meaningful work, and our family is healthy because of Minnesota Care. We've been hearing talk about reinsurance plans and ways to stabilize the individual insurance market, and we say Minnesota needs a better plan. Let's not hand over hundreds of millions of dollars of public money to insurance companies with no accountability. We can do better. The values of the Minnesota Health Plan should be on the table as Minnesota considers real solutions for health care. We should be building on what works in our healthcare system, like the public Minnesota Care Program, and open it up to all Minnesotans to buy into. Farmers like me need access to quality health care for prices that we can afford. Minnesota Care provides that for my family, but the corporate insurance system is not delivering that for far too many Minnesotans. We need a better plan. Thank you.
Any questions?
Economic analysis of universal plans like this has come out as being less expensive than doing what we're doing now. I'll give you multiple examples, one of which was there was a study done by the group Growth and Justice of a generic universal plan in Minnesota 4 or 5 years ago. Was actually conducted, the research analysis was by the Lewin Group, which is a health economics consulting firm. Happens to be the parent company of Lewin Group is United Health Group. They're not obviously in favor of a system that would replace insurance, but they did come up suggesting it would save, I think the fact sheet had some of the numbers they had used in there, would save a median income family several $1,000s a year. And in terms of overall cost, I think they were talking several billion a year cheaper than we're spending now. The difficulty is we're talking about refinancing the entire healthcare system, where you'd pay your healthcare, it'd be premiums based on ability to pay for individuals and families, and for businesses it would be a payroll tax. For right now, what we have is 1,000 different sources of revenue here and there, and we think it's actually going to be cheaper. Economic comparisons around the world suggest the same thing, significantly cheaper. But we've actually asked for economic analysis. The governor put $500,000 in his budget last year to try and make that happen. That did not pass. We think we got to move forward on getting more details, but the bottom line is the assumption is it will save money to give people health care when they need it. Sure. Right now, Minnesota last year, 2016, the health department estimate was we were going to spend $50.7 billion. That's well over $9,000 per person. You don't see that as an individual. I mean, half of that's paid for by government, whether Medicaid, Medicare, Minnesota Care, all the state, federal programs. About half is paid by government, about a quarter is paid by employers right now, about a quarter by individuals. But right now we're spending about $9,000 a person, and for comparison, I think there are about 3 or 4 countries in the world that spend more than half that. Everybody else spends half that or less, and their outcomes are better. We're not the worst outcome by any means, but I think the handout showed we were like 40-something in life expectancy. We're paying twice as much, we're not getting it. So I'm not saying we'd save half as much. I think we'd be spending almost as much as we do, but we would be doing it more efficiently. 50.7 billion. No, that's everybody. That's everybody. What you pay, what your employer pays, what schools pay, what everybody pays to get government. Okay. I don't see the governor's thing is connected to this in any way. It would offer, what his proposal was that people over 200% poverty could buy into at market, at whatever the rate, whatever the market rate is, that they could buy into Minnesota Care. I think that's nothing related to this. In the short term, it would be very important because I think there are lots of people in a lot of counties have very little choice right now. I don't think it fixes it, but it certainly, like what we did a couple weeks ago, I think it's very important that we offer alternatives. Last week we provided the rebates to people who had those high increases. So it's not related to this. I think it's a good thing to do in the meantime till we fix our system, because it's a broken system.
Yeah, the public option also fits into the kind of market competition model that we have now, and it does offer a choice for people that they don't currently have, and is helpful in that way. But what we're talking about is we want doctors and clinics to be providing the competition for the clients that they might serve rather than insurance companies. So much of the talk is about getting access to insurance, which does not, as proven, give people access to health care, which is a really important distinction. There was also another study maybe 10 years ago done to the earlier question by the state of Colorado, comparing all of the plans that they could possibly do. There's one very much like the Minnesota Health Plan, which would have saved over $1 billion, the Lewin Group determined. So we really believe that this is a way for us to contain costs and have in place a policy that will improve our healthcare system, make it more available to people, and really be able to do things that we can't do right now. And if you're interested, John has written a book. I'll give a plug for that, which does answer many of the other questions. If you're interested, there's also a website, and I don't remember the exact. Do you remember the?
mnhealthplan.org for more information on it. And the bill numbers in the Senate, because we can have only 5 authors on a bill, it's Senate File 219 through, I think, Senate File 223, and the House file is 358, and you can have like 35 authors on it, but you have another bill that, because he has 42, and I think we have 23 co-authors in the Senate. We do intend to request hearings. We're going to try, and we're aware of what the numbers are in terms of chances. We want it to be part of the discussion because, frankly, whatever they're proposing this year is not going to fix the problem. We're concerned it's going to make it much worse, and we're going to need to fix it sooner or later. We'd like to fix it sooner, but that's why we're putting it out there, and we do want it to be discussed, and we intend to. A lot of us here are on the health committees and intend to be voting these ideas when we discuss other alternatives.
I think also that we want to make sure the public understands that this is a viable option that could be out there. When we see policies are influenced by public input, and the minimum wage increase that we went through before, people clamored for that, and it was very popular. I think if they get the word about how this could change things for them, they might get behind it and help us persuade others that this is really the way to go.
First of all, the premiums that you now pay to either through your employer or pay directly to health plan, you'd be paying them to the Minnesota Health Plan. Premiums, unlike the current ones, would be based on ability to pay. So it's affordable to everyone. Everybody pays something. It would replace copays and deductibles and excluded care because, again, it covers things like dental care that are often not covered now. So it would be paid for in that manner. And one thing to help give people a picture of how this works, if you want to see what the difference between what we're doing now and what we're proposing to do would be to compare how we fund our schools versus the way we fund our hospitals. If we ran our schools the way we run our hospitals, every teacher at the end of every day might spend 15, 20, 30 minutes calculating how much time he or she spent with each student, then they'd send it to the billing office, and the billing office would fold in all the overhead, the utilities and everything, and then they'd send it to all the families, the parents, and their school plans, their Blue Plus education plan, and their whatever education plans, and then they would all pay for different services at different rates, and the parents would have to pay co-payments, and some of them wouldn't pay it, and therefore you'd have to have a collections office. How would that improve education? It wouldn't. How would it save money? It wouldn't. In effect, it would be taking time away from education. It takes doctors and nurses time away from providing health care in order to figure out billing stuff, and we think you get better care when they can spend time with the patients instead of spending time billing, and frankly, it's a whole lot cheaper. Thank you.
Are there any other states in the United States that have implemented a similar type of plan that we should be modeling, or is it something that's in the forefront of healthcare reform?
No, no other states have done this. A lot of states have been interested and expressed ways of doing it. I think none of them are as comprehensive of a proposal as this that would cover everything, and including long-term care, including everything else. And the system is just broken. Look at long-term care. Public already pays, taxpayer dollars already pay for 3/4 of all long-term care in Minnesota. The other 1/4 of it we spend all the time, people who are trying to hide their assets, the state trying to recover their assets, people debating whether to buy long-term care insurance, which doesn't really work either for the insurer or the patient. Spend all that time fighting over 25% of it. If we focused our efforts on providing care to people, it's actually a lot cheaper, and it saves every retiree, everybody else the hassle of, do I buy this policy when I don't know that it covers what I need? Thank you. With that, thank you all. We're happy to stay around if you have more questions. Thank you very much.
Thank you.
Excellent. You've been there. Let's talk more.